a very, very warm welcome for this session on the panel Latest Developments in the Health Tech Sector. Today we're going to discuss the question what the actual COVID crisis means to the digital transformation in the health tech sector. This includes lots of aspects like data protection, also the legal framework as well, but also business concept, new business models, and so on. Let me introduce you now to Andreas Nemeth. He's CEO of UNIQA Ventures, the venture capital arm of the Austrian insurance group UNIQA, and also invested in lots of super interesting startups in Austria. Hello, Andreas.
Hello, everybody. Thanks for having me.
Paul Varga, founder of the startup Playbrush. The startup developed an interesting solution which brings gamification into brushing the teeth. Hello, Paul.
Hello.
Nice to have you here.
Thank you.
Next, Edson, founder of the British-based startup Second Nature. This is a digital program that helps people to change their lifestyle habits. Hello, Chris.
Hi.
Next, Anton Kittelberger, co-founder and CEO of mySugr. mySugr developed a really innovative solution for people who suffer from diabetes. The startup was acquired 2017 by Roche Ventures. And he's not just CEO of mySugr, he's also investor from sweet.ventures. Hello.
Hi, thanks for having me.
And last but not least, Jama Nateqi. Hello from Symptoma. Hi. You have created the biggest disease data platform in the world. May I start with you as well, because you have a really, really interesting project going on right now. So maybe you can elaborate on that. It's dealing with COVID-19.
Yeah, sure. So thanks for the introduction and thanks for having me. So I'm Jama, medical doctor and co-founder of Symptoma. And Symptoma is the digital health assistant. So what does it mean? Well, patients and doctors enter symptoms, they answer questions of our chatbot, and then they receive a list of matching diseases sorted by probability. So it is based on 14 years of research and development. And we have established, as you said, the biggest disease database in the world with 20,000 conditions and billions of connections to symptoms, risk factors, and statistics. So what we did is essentially, after 14 years of research, it's like showtime for us. COVID is like one of our core strengths that we can actually apply to. How we did it, so I think even in early February, we just entered COVID as a new disease concept in our database, and then the technology was learning from the literature that has been published more and more during this time, in order to then actually understand what the symptoms are of this specific disease. And essentially, before we actually communicated that our solution, so Symptoma.com, is also working for COVID, we actually did a study first in order to determine and validate the accuracy of our system. Because a system doesn't make sense if you do not catch most of the real COVID patients, and it also doesn't make sense if like normal patients with only a common flu or hay fever are being made a COVID patient. So you have to balance those really closely, especially if you, like we have, screened millions of patients by now. So in this regard, we published a paper. The accuracy was quite astonishing high, 96%, that there's a good chance that we correctly established a patient as being at risk of having COVID. So a risk that warrants a further diagnostic workup. And it's not the final diagnosis. And like that, now the second study is underway, where we're actually comparing our solution to the other symptom checkers that are out there, for instance, from the Center of Disease Control or Apple. And the results are going to be astonishing, but I won't share it right now. I won't break the news yet, but Brutkasten will have a chance later, of course.
Jama, is it right that you were like also mentioned by the European Commission as an official solution to fight COVID-19?
Yeah, we have received a couple of letters from the European Commission who have identified Symptoma as one of the core potential solution for this pandemic, and they have also not only tasked us but are also officially recommending Symptoma to be used. And so we are overrun by hospitals, governments, and companies who are using Symptoma already. For instance, at the entrance of a hospital, to check whether a patient might have COVID and then to triage them, to send them to a specialist if they have a high risk before they actually mingle with the other patients and make everything worse.
Really interesting solution. And yeah, thank you very much for sharing. Can I hand it over to Anton? Anton, maybe you can introduce mySugr. I mean, normally you don't have to introduce mySugr in Austria, but as we have today a really international community as well, maybe you can just introduce mySugr, what you're doing, because you're actually quite famous as a startup or a scale-up.
Thank you very much. Yeah, thank you, Martin. Thanks for having me. Yeah, so Anton, I'm CEO of mySugr, and mySugr has grown from, I would say, a digital app that tracks all your data around diabetes to become an integrated diabetes management platform. And that means that we do more than just track data. We help people make the decisions in everyday life when they suffer from diabetes to really know what the next step is in order to manage the therapy, but then also help them with getting the supplies or having coaches and their doctors at hand to make sure that they move along in the therapy well and stay in range. Right, diabetes is a problem that you suffer from for your life, basically. So it's not going away, and there is no vacation. And we just really try to make the time that you spend with diabetes suck less. That's also our tagline. We make diabetes suck less. And
you were also acquired 2017 by Roche Ventures. Yeah? So how it changed like the way of your startup and doing business in your field?
Yeah, so we've been acquired 2017 by Roche, so Roche Diabetes Care, and we've been, I would say, cautiously integrated into that bigger company. At the time, we were 45 employees. We're now almost 180. So we grew a lot, and we extended our scope quite significantly. From kind of the service aspect that I've already briefly touched on into more focus areas when it comes to different therapy segments. And we also integrate more with Roche Diabetes Care when it comes to exchanging data, using the access also to the doctors, because diabetes care is very much established in the doctor's office. And we were very much focused on the patient. And so that really brings along a great combination for customers, for patients, healthcare professionals, but of course also payers, because that allows us to truly integrate. And what does it mean for us as a company? Well, there's a lot of opportunity. Of course, there's also quite some change, yeah, and change that you also feel in everyday life. We're not as autonomous as a small startup anymore, right? So we need to align our strategy with the bigger organization. But I think there's a healthy balance of alignment and autonomy still going on to still spur the creativity in the company and make sure that this remains a great place to work.
Mm-hmm. And you are also investor, CEO and co-founder of sweet.ventures, no? Is this correct? No?
Yeah, I'm a co-founder of sweet.ventures. This is we started this right after our exit. So this basically is our group of people that have built mySugr plus some advisors, and it's a unique combination of people that have all the skill sets that you need in the medtech space. There's also people with diabetes in there, such as myself. So we also use kind of the focus that we've built in mySugr to now invest. We focus on diabetes and its comorbidities. And I will say sometimes we step outside because of a really great team or a great topic that we like, but we are basically focused on diabetes. And there we can really help with our expertise when it comes to regulatory, technology, product, even market access. And since mySugr has been an open platform, we basically had partnerships with many companies in the field, and therefore have an extensive network across Europe and the US that we can now leverage for our startups. And one of the startups that we invested in is actually here present at this panel, which is Chris and Second Nature, and we're really happy to be an investor there too.
Perfect. Before we hand over to Chris, I really want also to mention that the community can also post questions here in this chat. Just go for it. I want to encourage you. We are looking forward for it. Yeah, then let's hand over to Chris. Chris, maybe you can just give us a short pitch about Second Nature, what you're doing.
Yeah, of course. So I'm Chris. I'm the CEO of Second Nature. We help people build healthy habits, specifically in the obesity and type 2 diabetes space. So we're one of the fastest growing companies in the UK. We just raised our 10 million Series A, in which Andreas from UNIQA invested in us, and also Sweet Fund. It was really great. The main thing we do is we try and identify where people need help changing their lifestyle. So we now have 5 peer-reviewed papers on our efficacy. It's mainly around losing a sustainable amount of weight. We're now nationally commissioned in the UK's NHS. So all across the UK, we're basically commissioned for helping people get out of the risk zone for type 2 diabetes. Mm-hmm. So yeah, we've been going since about 2015. We also had a partnership with Roche that's still kind of ongoing. So yeah.
Thank you very much. And let's hand over to the last founder, Varga from Playbrush. Maybe you also can introduce your solution.
Yeah, sure. So hi, I'm Paul. I'm the founder and CEO of Playbrush. And we help people with improving their oral care, so basically dental health via technology. We are really in the consumer health segment. So it's less about regulatory, etc. So what we basically do, we make toothbrushes smart and track the brushing movements and the brushing behavior and habits of our customers, and provide them feedback how they can improve their oral care, and embed that in basically prevention packages, so that they foster prevention and are less dependent on painful dentist appointments and the obvious costs that are coming up in the long run. And Andreas and UNIQA Ventures is also one of our investors. And we have also Speed Invest and 2 other larger shareholders on our cap table.
And you're now based in London?
We have 1 office based in London and 1 office in Vienna. So we have 3 co-founders. Toulouse, who is our CTO, is heading the London team, which is actually very tech and data driven. And our commercial and hardware logistics team is based in Vienna, and I somehow go back and forth. And
many innovative solutions from different fields. Let's hand over to Andreas. Andreas, you have the bigger picture, I would say, as an investor of UNIQA Ventures. You're invested in Healthtech startups. And maybe let's go now into our deep dive and also in the discussion in how COVID-19 is changing the digital transformation in the Healthtech sector. Andreas, if I start with you, maybe you can just elaborate a bit. Is there a new way of thinking digital transformation in healthcare, in the healthcare system, also in healthcare startups going on right now at the moment?
Sure, Martin. Thank you very much. I think maybe before I answer that question, I just give you a very brief context what UNIQA Ventures does. 2 great startups that we have invested in have been already mentioned. Actually, UNIQA Ventures was created 3 years ago with a clear vision to support founders in industries that see tremendous change in digitization, like the financial services industry. We invest in fintech startups. We invest in insurtech startups because we believe in change in the insurance industry as well. And last but not least, we are investing in the healthcare space because we definitely believe that this sector will see tremendous change and is already seeing change, has seen change before the crisis. And I think that underlying trend that we've seen in healthcare is even accelerating now since the last 8 weeks. In Austria, we have introduced during the crisis the new services, telemedicine services that have been impossible before. I think what has changed in the last 8 weeks was more than in the 8 years before. So we definitely see a lot of change. We definitely hope that this will stay. I think it's not a short crisis, but unfortunately we believe that this new normal that we will see is definitely changing all our lives. And health has been on top of minds of everybody already before the crisis. I think if you ask people what's important in your life, they will tell you it's my family and it's my health. I think either way, number 1 or 2. And I think we are lacking that innovation in healthcare and startups. We definitely invest in startups because we believe startups can be the catalyst for change in the very traditional healthcare space.
Mm-hmm. Maybe if for the international audience, maybe you can give us an example how it changed, like the last 8 weeks.
Yeah, so I think before the crisis, there was Austria was a bit lagging behind compared to the Nordics or Germany, where the regulatory or the legal framework has already been established for telemedicine 2 or 3 years ago. Austria was a white spot for services like these. For example, if you wanted to see a GP, then you had to go to this physical office. I think that has changed. If you need to see a doctor now, there are 5 new companies that only started within the last couple of weeks now. So I think that has definitely changed the way primary care is delivered, and I think that's not the end of the story.
Mm-hmm. Maybe I can hand over to Chris. How is this situation in UK? Is it different to Austria, as like Andreas mentioned right now?
Yeah, so we do a lot of work in the consumer space, right? So we have a lot of people just buy our program. The really interesting trend that we saw is that in April, kind of late March and April, consumers just weren't spending anything. And I think it made me really realize just how the direction of your startup is sometimes so out of your control. So people just weren't spending on things, even though it was very clear that taking care of your health, which is exactly what we do, was more important now than ever. It's more important now than ever to take care of yourself. But people just weren't interested. They were locked up at home. Suddenly, like, well, if I'm locked up at home, I'm depressed, I'm gonna have a pizza. That was the mentality, I think, for a lot of people. And then towards the end of April, you saw it completely switch. And it was almost as if the whole of the UK was like, oh no, actually it is now important that I take care of my health. I'm tired of being in lockdown. And then it switched. And so we had like an awful March and first half of April, and then suddenly it picked up again. And yeah, it really illustrated to me just how sometimes things are really out of your control. And I'm sure, you know, we're on the nicer end of that. Obviously a lot of startups, you know, in the travel and hospitality space are it's completely out of their control. But so yeah,
like also consumer habits are changing right now. Maybe if I hand over to Jama, a question. You also realized like different behavior from your users as well in this time?
Yes, of course. People are worried regarding their symptoms and check whether it might be COVID or something else. So they are more aware when they actually have a sign. Generally, I think the broader trend is rather that I'm sure you know those maps, those COVID maps, world maps, right? And the problem I always had with those maps is they're only showing where the PCR test or the diagnostic test is actually available, and you see a black spot like in some of the yet developing countries. Which doesn't make sense. So our data actually indicates something else. Yes, we have millions of monthly active users, both patients and doctors. We see actually companies that are not really on the spot of those typical COVID world maps. there the infection rates seem to be actually rising. And this is also something that we are going to publish soon.
Mm-hmm. You're also in close contact with health institutions, as I'm right. So maybe you can tell us a bit how the health institutions are reacting right now in this crisis.
Yeah, sure. So first of all, there's the price, as everyone is, and then they are gathering, as they should, in intelligence on how to tackle and what technologies to apply to actually gather real world data in real time. And so what they like about our solution is that what I just outlined is before you actually already do have a hard diagnostic test, the problem is you cannot test everyone, right? It's really hard to do so, and especially in countries where the resources are quite limited. However, with those predictive tools such as Symptoma, you can contact these, so it's really safe and anonymous, and it's online for patients to do. As a health authority, already gathering real-term insight in terms of in which areas are particular infections such as COVID actually on the rise before you actually deploy the test. So you can actually gather the intel and then react accordingly, and then also prioritize the resources that you have, especially for those patients, because if all of us have a COVID, it doesn't really matter because we are too young in order to be at an actual risk group. But if we have a patient that has comorbidities, this infection for them, for those patients, this really means something. So there you have to prioritize the resources. There you have to say, okay, you should get the diagnostic test now, and we should make available resources at the hospital for you in order to take care of you instead of leaving you in self-isolation.
Like times is changing also, like habits are changing, as Chris mentioned. So it might be that people are getting, they invest also more money in their own health care. Paul, how is your business doing right now at the moment? Is there like any change happening right now? So people are, I don't know, spending more money on healthcare for like products like yours because you have a like really interesting product in the consumer market.
I think it's a bit, so the long-term aspect we just don't know, short-term is a bit what Chris mentioned. So in the very beginning, when the lockdown started, you had a very short drop because I think attentions were just somewhere else. And then if you look at our e-commerce sales, they really increased over time. There might be the aspect that people in general think more about the hygiene, which also includes the dental hygiene. It also might be the aspect that people just have more time to do online shopping, and we don't have any data on that at the moment. Obviously, we sell our products also in retail, and here is quite interesting what we see also in the discussions with traditional retailers in the drugstore space, but also in the pharmacy space. So if you look at the products that are really directly related to COVID, like I don't know, disinfection soap, etc., those are skyrocketing in sales. Or other products in traditional retail are suffering while e-commerce numbers are going up. So maybe there is also a behavioral change that might be a long-term change. What is quite interesting, we also saw a change in usage. So according to our data, and we have actually thousands, tens of thousands, hundreds of thousands data sets about people brushing their teeth, and toothbrushing habits have improved in the times of COVID. So people brush their teeth longer and more often, which is a maybe positive side note. Yeah. Generally, so we are fairly happy about our about the development of obviously the usage rates, the e-commerce rates, the subscription rates. This is all quite good.
Anton, do you share like the opinion of Paul concerning the?
Yeah, I think for us it was a little bit different. So when it comes to kind of uptake of our user numbers, we didn't see we did see an increase, but not kind of an enormous increase. What we did see is certainly within the existing user base, kind of a shift in user habits. Yeah, so we saw a lot more, for example, the export features towards the doctors being used. So the pull from the doctor was suddenly a lot bigger, and so our parent company, they have a software for doctors, and there's suddenly a huge pull from the doctors to be able to access the data from their patients remotely. Yeah, so because they still had to provide their service, and with diabetes, it's a continuous thing, and so we saw quite an increase there. We also saw in the US specifically, where we work more with payers and benefit managers and so on, we saw a lot more interest in listing our service in their catalogs, right? So they wanted their companies now to have proper remote monitoring tools, proper remote management tools for their employees, which is a great development. And then overall, I will say, right, so mySugr, Roche, I would say we're definitely winners out of this crisis, yeah, because suddenly the things that we've been working so hard for over the last couple of years have gotten supercharged. Yeah.
Andreas, you wanted to mention something in this regard before we go for the first question?
Yeah, I think I fully agree to what Anton said, because I think that there is a shift in what we see as an underlying trend is that people really take care of their health, and this mindfulness movement. I think if it's preventive care, if it's dental health, if it's just losing weight to live a healthier lifestyle, I think these are basic trends that are out there since a year or two, maybe really already developing. But I think it's now. What has really changed is that this exponential growth kicks in now, that people sit at home, think of cannot go to the gym, start their Zoom sessions and have the gym sessions at home. I think they take care of themselves. They live healthier lives while in home office. I think that's definitely a trend that we confirm. And maybe just to the startups, because they mentioned there is a lot of uncertainty, but what we see now is that a lot of startups already accommodated to the new situations, that startups so quickly adapted to the new situation. And especially in the healthcare space, we see a lot of opportunity now. And I think those startups well prepared now already adapted to the new crisis mode can now really benefit from the opportunities, while I think other sectors are much more heavily hit by crisis. And if you look at the verticals of the New York Stock Exchange, I think healthcare is one of the very only verticals that is already back at pre-crisis levels, and that's why we firmly believe that that overall trends for healthcare startups are good. If you are well prepared, if you have done your homework in the last couple of weeks, extended runway, I think now that you really start switching from defense to offense already, and leveraging opportunities that are
also
out there.
Opportunities for investors. We're gonna discuss this later on, but first let us answer this question. This question is for Jama. How does Symptoma differentiate between COVID-19 influenza like infections? When did you start with the COVID service in your app?
Yeah, so we already started with the COVID service on our web app in early February. The differentiation is also something that we have published. So we've shown with really similar diseases such as common cold, influenza, hay fever, and even COVID-19, how well the system can actually differentiate. So it still can be that a patient with an influenza case will also have COVID in the top 10 of our search results, but influenza will be most likely ranked higher. It's not only because of the higher probability of having the normal influenza, but also because of some disease-specific symptoms. that really differ from both diseases. It's not all really the same.
Mm-hmm. Thank you very much for answering this question. Also, thank you very much, Kira, for this question. Let us talk now about like the investment part. As you mentioned, Andreas, like times might be good for the health tech sector. Maybe you can elaborate a bit how it's gonna be in the investment sector right now at the moment. Are there investments happening right now, or is it due to crisis totally nothing happening at the moment? Andreas?
No, definitely. I think there are transactions happening every day. I think some of them have already been arranged before the crisis. So we'll definitely see the effect maybe only in the next couple of quarters. But especially for the healthcare sector, we are still positive. I think what has really changed is only to the positive of that of the healthcare sector. So you mentioned there is a high awareness now of health. There is a lot of money still at the sideline waiting to be invested. Although we have this very positive view, I think it will take maybe another quarter that people will come back to the market, to transactions, prepare for new transactions. I think there was some high level of uncertainty in the last 8 weeks. I think that needs to settle before we see transactions kicking in again. But unlike other sectors, I definitely believe that healthcare will be one of the least affected by that.
Also, if I can hand it over to Anton, you're also investor. Do you share this opinion?
Yeah, definitely. I will. I mean, we're really typically we're a very early stage investor, right? And we do differentiate in terms of interest to models where we want to invest into, and also when it comes to valuations right now, how you are planning to approach the market. Because I'm fully with you, Andreas. Healthcare is definitely the big winner out of this crisis. But if you are not an established company yet, and you have a B2B model, for example, sales remain difficult, right? In this crisis, so getting actually your product sold without this personal interaction is still hindered, and I think this also doesn't allow you to get the traction that you would normally be able to get. So therefore, I think the real winners early stage are the companies that can show B2C traction really fast. They might even be the ones that have the opportunity to increase their valuations in these times of crisis. And then on the other end, I would argue you see more established companies that already do have these B2B relationships or have some proven track record also to be the winners, because they don't need to prove and build the trust relationships anymore to new customers than others do. For example, because you brought up the stock exchange, a company that I follow closely, of course, is Livongo, for example, basically a company that does something very similar to what mySugr does, and they are publicly listed in the US. And before the crisis, they were worth like 2.6 billion or something, and I already felt, well, this is a crazy valuation at the time. And now post-crisis, in just 8 weeks, this company is now worth 6 billion. Yeah. And the reason for that is basically they already had many of the Fortune 500 companies signed up, but they didn't really get the members to that extent that they normally had. And so this huge boost comes, and suddenly the members skyrocket, of course, because they are all customers now. They already have this contact. And so I see it a little bit more differentiated in terms of access to market. But of course, healthcare, health tech, we are the winners of this crisis.
Mm-hmm. Yeah. Andreas?
Yeah, just maybe to add here, I think for the B2C space, I mean, if the unit economics work, then I fully confirm what Anton said. I think but when we look at the overall sector, there are hundreds of startups out there. And I think what investors are now becoming more of aware of is that there are different business models, different companies, different founder teams. So I think there is this saying that great companies are built in times of crisis. I think there are great companies built all the time, but now you really it's tough. It's a tough environment. Also, if all signals are on green now for the healthcare space, it's not an easy task. I think Jama can tell you a story, and which is dating back to the 8 years now, actually. So I think Anton has seen a lot of ups and downs, and all the founders, I think, share that wisdom that it takes time. And I think in the healthcare space, unlike with other sectors, it always took a bit longer, I guess, because people are also more patient because all the certification processes and so on. If that takes time. That means startups have to they have to be well funded, need some longer runway than maybe in other verticals, and you really have to be very selective. You have to be even more selective maybe before, and that's why I think valuation is not going to skyrocket in the upcoming months in the private markets, because you have to really find the right risk return profiles. And I can confirm that startups that have already established product market fit, that are already on revenue, that they are better off now. Whereas if you really start from scratch, I think it's always a very, very tough time. Yeah. But that's why we as UNIQA Ventures, we focus really on the early growth stage with companies already on revenue, already with an established product. Because otherwise, I mean, it's still a
so it's hard
risky
also
business
for new startups to come up in this field. Another interesting question deals also with the question about the use of data, how we can use data, also startups, and maybe a question in the audience as well. Is this changing right now? Do we have to face like more liberal law also to use data to find up new solutions? Maybe I can hand over to Chris.
So the question is around whether or not our attitudes towards...
Yeah, also because like in Austria, we also maybe, Andreas, you can also tell us that we have like a really strict policy about using data as well. And is this changing right now?
I mean, I think to Chris, I think we can... I think definitely Europe and the US might be different in how people use data, but I think maybe Chris, how ready people are in sharing? Has that changed the readiness of people?
Yeah,
to
I think that's
share
why
data?
I was struggling with it. I haven't seen a difference as a result of COVID. Maybe, and I mean, this isn't really to do with us, but maybe there is. I could argue it either way. I think some of the new COVID tracking apps, the NHS famously has gone and developed their own COVID tracking app. That's a whole other debate. I'm not really sure they did that. I think the UK public is fairly divided about whether or not they're willing to submit their basically location and interaction data to that. It seems like public opinion is they're happy to do that because it's going to reduce the R value of coronavirus. At the same time, is that an attack on our freedoms? Yeah, I don't know. I don't think I've seen a big trend in the UK the way though.
If I may jump in,
yeah,
Martin, I would say I observe two things. The short term or within the crisis, I think overall you see kind of less awareness when it comes to data privacy and more willingness to I don't know, even use email to exchange medical data, right? I mean, in Austria, we're doing this now. You're getting your prescriptions via email, which is, I mean, finally, yeah, but you're getting this via email. It's not a secure channel, not at all. But we're all happy about it and we accept it. So I think that's the short term. the medium to long term, I think, out of the crisis, and because we're now discussing tracking everyone, contact tracing everyone, then quarantining people because of certain interactions that they had with others, I think that there will be more and more awareness about this. And these solutions, if they really want to have broad adoption, they need to be super strict on data privacy, because otherwise it's just going to blow up into governments' faces, right? So this will not happen. And so those are the two things. I mean, right now, kind of everyone is happy about it. It's really pushing the trends, and finally things are working. But looking towards more of the future, I think will be more strict, and then you would potentially also see some bigger fines because more people will watch it. And then this kind of comes in a cycle where people actually will have to invest into more rigorous data privacy.
If I may add.
So yeah.
Sorry about that. I think it's a crucial time for us, especially as digital health startups, to actually advocate both for validation and data privacy. So COVID in any crisis is not an opportunity or an excuse to actually say, oh, we make a compromise here. We should still uphold the data privacy and the validation, because it's, as Anton said, it's going to blow up in the faces of the governments, but also of the digital healthcare industry as a whole. And we cannot lose trust and cannot allow this. And it's a pity that the tracking apps are gaining so much traction. There are other solutions out there as well. And if the public mind is forgetting about data privacy, it's probably our task to actually remind them of that.
How we can encourage like a discourse, a transparent discourse about this topic in our society?
Like if you're bringing our solutions ourselves to actually advocate and say, okay, look, this is how we are taking care of the data privacy. We are not, for instance, from Symptoma's side, we are not even archiving the IP addresses. We are not collecting email addresses. We do not want to have any name. It should be really used in an anonymous way, and to be transparent about it. And also regarding the validity, to actually, I'm really terrified that big brands such as Apple and CDC are publishing so-called self-checkers for COVID without any validation provided. So it's a kind of a double standard to not allow any applications into their iTunes and so forth. But on the other hand, actually having solutions on their own that have not been validated. And every digital healthcare startup, especially if you want to be successful, and you have many founders here as well. I mean, you all know it makes a huge difference if you actually have a scientific validation or not. And the same is true for data privacy, to actually by design to take care of that, and to be open in order to close any leaks that you might have in the process.
Thank you very much. We have a next question. Which kind of startups in your portfolio are now finding traction for Andreas?
So I will answer it in actually for the healthcare startups, because I think it's and I think what holds true for them also holds true for other companies in our portfolio in the fintech space. What we've seen is that B2C models definitely thrive short term, because we also see Google AdWords becoming cheaper in times of crisis because of the sheer online volume. People are online much longer. So we've seen positive trends here. What we see is that but on the other hand, that B2B startups also benefit, because they are more resilient in times of crisis. Startups with a very strong SaaS base fee income also perform well in the crisis. So, for example, we are invested in Austrian startup fitness and sports venue business, and they they have a base revenue from SaaS, and they've seen decrease of 20% maybe in transactions in the March March and April. But we thought, with all the fitness studios closed, that will turn out much worse, and maybe with a 90 or even higher percentage of decrease. But we see that startups really adapted fast. This startup of ours, they started with online gym sessions now, and they are at pre-crisis levels and even beyond. So I think those gain traction, those perform well, that can adapt to the changing situations quite rapidly, and it's the strong founder teams, and that's, I think, how you really make use of the current situation. I think B2B startups, they definitely have the long sales cycles, which has always been a problem before in the healthcare space. But at the current situation, we see that the obstacles that are sometimes in your way are removed by the COVID situation. So because what Anton mentioned, this e-receipt, we've been waiting so long for that, but now it happened overnight. And I think the mental models, what is possible and what is not possible, have really changed a lot. And I think if that remains, I think that's phenomenal. But actually, it's those who are performing well that are reacting to the situation and adapting. I think no one is really extremely affected at the moment, given that we don't have any investments in the hospitality or travel space. So we are lucky.
Finding solutions, really also quick solutions, being innovative, that's what startups are for. Also another question, are also health institutions are working closer with startups right now? Is there any a trend happening right now here?
We've seen something, sorry.
To Andreas, maybe?
So maybe just as beside being an investor, I've also been one of the founders of the Health Hub Vienna, which is an initiative here in Vienna, Austria, which really tries to find the digital health startups in Europe, bring them to Vienna, and actually match them to corporates, to institutions like the social security system, and because we firmly believe that these startups are really at the forefront of change and can really be the catalysts of change in the very traditional healthcare business. So and we see a lot of more interest now. We've actually turned that accelerator program, which was a session of multiple events over the course of the year. Now moved it completely online. We also do that now on Zoom and conference formats like this. And we've seen a lot of interest now, because I think healthcare is on top of mind. And if it were of interest for only a few people in healthcare, now it's really we had a very interesting talk with the CEO of the Austrian social security system on Brutkasten just recently. I think that was great to see that the CEO of the Austrian social security system says he wants to work with startups much more closely together, because I think it's now a time of innovation and a time of change, and changing 100-year-old healthcare system, a very well established one like the one in Austria, which is 100 years old. I think is a huge effort to bring in change. You have to induce that change, and it needs a lot of endurance and a strong push. And what we definitely strongly believe in, and why we created the Health Hub Vienna, was exactly to bridge that and to to connect the startups and the people that really can bring change to the system, to the key stakeholders that can take the decisions.
Is there the same development happening in UK, Chris? Is there also like health institutions working together with startups?
Well, the most interesting trend that I've seen is that, so we do a lot of work with the NHS, which is the NHS paying for GPs to refer patients onto our program. So a GP will see a patient, they'll identify that they need lifestyle help, and they'll say, hey, okay, I'm going to refer you to Second Nature. Obviously, that's not really happening at the moment because GPs are shutting down and things. So the NHS is now looking at paying for performance marketing to acquire customers for us, which is pretty unprecedented, right? So this is the NHS paying for Facebook ads. So I just think that's really interesting.
Definitely is.
I never would have thought that was going to happen. It's like a crazy like capitalist dream where the public sector is like paying for Google and Facebook ads.
Anton, you wanted to mention something?
No, I'm just fascinated by that. I think it's great. I've never heard something like that, and that's I think it's a good example of what is happening and what the value truly is that our solutions bring to these institutions, right? That in these times they're even acquiring customers for us, right? So it's great.
Yeah, that's it. The level of pressure is potentially a bit higher in the UK in general. So one of the biggest problems probably for health tech is that the legislation is so different in specific countries, and you can't really compare the NHS to what's happening in Austria. But it's actually quite a nice example. And maybe obviously the NHS comparing it to the Austrian public health sector is obviously, because of the pressure, also a bit more advanced in working with startups and new solutions because they have to.
Unfortunately, we already have to come to an end, to the last round. So my question is, what can we do, or what are the biggest challenges right now to make this digital transformation sustainable as well for a long-term perspective? Who wants to start?
I'm happy to start. I think what we would need to do overall, maybe as also when it comes to the governments and to the health institutions, is, they've been so entrepreneurial in putting things in place that the public really needs now. And I think there was a like any of those measures that they put in place, I saw that they also put in place, kind of when this will end, or kind of naming it exceptions and things like that. I think we should really learn out of this phase and see what the impact was on this. I mean, I assume that many of these measures are seen as exceptions because they think they lead an insurance to overspend on certain items that they previously didn't do, right? I mean, maybe this assumption is wrong, right? So let's really learn what happened out of these measures, what comes out of these measures, and bring them into kind of more regular programs or regular measures that the public, the patients, the companies can all profit from that. I think if you look at DVG, for example, in Germany, of course, it was pre-crisis already, but I'm sure a number of countries and leaders are now looking towards Germany and say, well, that's quite interesting. If they're successful, we're going to jump on this too. And some countries even did already without the whole program, right? Just because of crisis. So I think it's a huge opportunity to not just say, okay, those were the exceptions, maybe let them run and bring them into proper programs and don't even stop them. I think that would really help the whole market, the companies, the patients, the doctors to drive digital health.
Mm-hmm. Paul, maybe let's continue with you.
Yeah, maybe to follow up on that, I think one of the issues for health tech in general is that it requires a lot of fairly bureaucratic and slow stakeholders, among others, governments, state institutions, etc. So I agree a bit with Anton that compared to other industries, it will definitely need a top-down approach to build the ecosystem. So we are a bit the odd one out here because we are more in the consumer space. But for Healthtech in general, I think there is so much regulatory, there is so much governmental and public influence, and without a top-down approach and top-down support for digital transformation, I think it will be tricky. And maybe following up on that, it's also, as I said, it's difficult for a startup which is purely a health tech to internationalize because the systems are so different. So this is also something to always have in the back of our head. If you look at the returns required by venture capitalists, you need to scale internationally most of the time, obviously not in certain domains. And in healthcare, it's significantly more difficult, and you need significantly longer time.
Thank you very much. Chris, can I hand it over to you?
Yeah, well, I think that's just touching on Paul's point. That's why we went B2C, right? Because scaling health tech is so challenging. Something I think about a lot is being in control of your own growth, right? And for B2B companies, you can be in control of your own growth. You hire a sales force. For B2C companies, you can be in control of your own growth. You hire a marketing team. You go to other countries. Whereas in health tech, there are systematic barriers to you growing in other markets. Yeah, so it's something I would caution anyone trying to get into the health tech space. It's not really related to coronavirus, but.
Thank you. Jama?
Yeah, it's an interesting topic. Because if you start out in healthcare, and we started out in 14 years ago, you are quite naive in terms of, oh, you're doing something which is nice for patients and doctors. It works, so you should be rich, right? And you sell your company and you go on, and I become a real medical doctor. No, I'm going to be a medical one. It's fine. But the tricky part is once you get the hang of it on how the business models actually work or do not work, how the healthcare system as such works, how people are incentivized. And then also you have to take into account it's a high voltage area. You can do a lot of things wrong. And whatever you do, you have to win every stakeholder and say, look, this is what we do. And our mission is that every patient deserves the right diagnosis and treatment. And so it's not, and as a founder in a health tech area, you have to know it's not only about the tech innovation. It's also, and it's also not only about the usability innovation, it's also about the business model innovation, about the process innovation. And it's really tricky because you have to win every stakeholder with their own interests by keeping your patient's interest first and to trying to match them without stepping on anyone's toes. And it's really tricky. And what this current pandemic is doing is of course, it's a kind of an accelerator. It gives you, it just shows how the human race is set in terms of whenever a challenge arises, that evolution is all about collaboration and overcoming those challenges in a spontaneous way and form. And this is what we're doing on a global level. And it's about startups collaborating with bigger institutions and health authorities. And now everything is running. So how does it sustain after the pandemic? Well, it sustains by not doing solutions that are for COVID only. So if you're doing it for hospitals, for instance, we show, look, right now we are doing it for COVID, but you will need it for other patients as well, because right now in your emergency rooms, they're waiting for 4 hours on average. So if you already know which patient you have to prioritize and which possible diagnosis they might have, you can triage them in a better way. Sure, we can start with COVID, but there's a way beyond. And to showing the path in the future helps, of course, so it's not a stunt. So it's something sustainable.
Thank you very much. Last but not least, Andreas.
So maybe Yeah, so if I may sum it up, I think what I really wish for is that we can sustain these windfalls from the crisis. I think, and there are 3 items that come to my mind. I think what has worked well in these last 8 weeks and has really boosted and accelerated health tech startups is that we have changed the regulatory framework overnight. I think we should really sustain that and don't stop that by the end of this year again and fall back into old regulations. So sustaining the regulatory framework is key. I think the second one, what we've seen and learned is that these huge institutions from the healthcare sector should work with startups. They should ease their procurement processes. They should make it just easier for startups to work with them, because that has been a hurdle. And I think that we have changed that during crisis now, that you can easily purchase software from startups without any full-fledged procurement process, because there is maybe not that 3 symptomas out there that you can ask for a proposal for. And I think the third one, and this is probably the cost of the crisis will be enormous for the society. And I think the only way to really afford for everything and also afford for a good healthcare system in the future will be through leveraging technology to deliver better patient outcomes at lower costs. And I think that the only way to achieve that goal and to make healthcare affordable again is just by leveraging the great technologies that all these startups here and out there and are offering. Producing better healthcare outcomes at lower costs is definitely
thank you very much, Andreas. Thank you very much to all of you. Really interesting thoughts and insights. Not just the solutions, but also like how we can strengthen also digital transformation in this kind of field. I think we all agree on that there is a boost right now happening, and let's keep it hopefully sustainable. And yeah, thank you very much also to the audience. And unfortunately, we already have to close this session. If you're interested to get into touch with the others, just contact them. You find all the information on the Podim conference. Thank you very much.